questioning which one the lasers could be the first lasers of choice for somebody that is starting the practice of aesthetic medicine, you have to think in an intense pulse light. I teach this class of lasers and laser-based devices, and the intense pulse light allow you to work in different fields. You can do hair removal, you can do pigment removal, you can do photo rejuvenation, and you can do vascular structure, telangiectatic vessels, which means it's not a bad idea to first choose a laser that allow you to have so much visit the room of lasers than getting a CO2 full phase resurfacing that you eventually is going to use it if you want to use it.